Hello, and welcome to Conversations from the World of Allergy, a podcast produced by the American Academy of Allergy, Asthma, and Immunology. I'm your host, Dave Stukas. I'm a board-certified allergist and immunologist and serve as a social media medical editor for the Academy. Our podcast series will use different formats to interview thought leaders from the world of allergy and immunology. This podcast is not intended to provide any individual medical advice to our listeners. We do hope that our conversations provide evidence-based information. Any questions pertaining to one's own health should always be discussed with their personal physician. The Find an Allergist search engine on the Academy website is a useful tool to locate a listing of board-certified allergists in your area. Finally, use of this audio program is subject to the American Academy of Allergy, Asthma, and Immunology Terms of Use Agreement, which you can find at www.faaai.org. Today's edition of our Conversations from the World of Allergy podcast series is targeted towards allergists and immunologists, but I really think that you're going to find it's applicable to medical professionals from all backgrounds, as well as patients with a wide variety of allergic conditions, and you'll find out why very soon into our conversation. We are pleased to welcome Dr. Maria Luz Lara-Marquez to discuss use of integrative medicine in allergy and immunology. Dr. Lara-Marquez is an allergist immunologist in private practice in San Diego, California. Dr. Lara-Marquez currently serves as the chair of the Integrative Medicine Committee within the American Academy of Allergy, Asthma, and Immunology. Dr. Lara-Marquez has a fascinating background with over 30 years of experience as a physician scientist and research in unique areas such as psychoneuroimmunology. I'm excited to learn more during today's discussion. And with that, Dr. Lara-Marquez, thank you so much for taking time to join us, and welcome to the podcast.
Well, thank you so much, Dr. Stukas, for having me on board in this podcast. I'm a real fan of yours and of your podcast as well. Very, very informative. And I hope this becomes of interest to our colleague members and other physicians as well.
Well, I'm glad that you're here, and I agree. A topic such as this, it really helps so much to have an expert such as yourself offer us perspective and a little more background than maybe you get from a glossary overview or just reading a paper, for instance. But before we really get into today's topic, I'd love to learn more about your very unique background and clinical and research interests. Can you tell us a little bit about how you started your career and what kept you interested in these very unique areas?
Yes, I think that's a very important question because I come from a family of 10 brothers and sisters, and I'm number 6. And I am a daughter of 2 psychologists. So that made a huge impact in my life because very early on, I was exposed to the role of stress in health. Because my mom used to say, "You're stressed out, dear. You know, that's why you're coming down with this flu." So, very early on in my life, I also was exposed to very traumatic experiences. And it kind of made me sensitive, right? To see, okay, how emotions influence our disease. And my father was a lawyer as well, very interested in academia. And actually, while he was doing in NYU a master's of international law, I was born. So I've also been very blessed of having the influence of the United States American culture and the Latin American Venezuelan culture. So I think that combination uh, brought me to expand the way I saw medicine, right? Whereas, we didn't get sick only because we had a particular infection or ailment, but emotions were in the background playing a game, playing a role. So that led me to, after medicine, became interested in immunology. And before I went into clinical training, I did a master's of immunology and basic research, where I actually did an immunology, the first immunogenetic study in Leishmania infection in the world. Actually, it was discovered a susceptibility gene. But at the same time, I went into investigating psychoneuroimmunology, which in 1987 was kind of blooming at the time. And so psychoneuroimmunology, it's a field that for me kind of helped me to say, wow, this is what we were looking for, how to understand this mind-body connection. Why is it happening? There is a whole biology behind it. And this term of psychoneuroimmunology was coined by Dr. Robert Ader back in 1987 from Rochester University. And he and Dr. Nicholas Cohen at the time did seminal studies on conditioning the immune response. It's a very long
Mm.
story. We can't talk about it now, but it's just fascinating how they're in their basic science, exposing animals to conditioning the response to some immunosuppressors achieved a biological response. So that was really, kind of blew the mind of many immunologists at the time that were resistant to even believe the data.
Hmm. Well, that's really fascinating. And I'll be honest, I had not heard the term psychoneuroimmunology until I did some background research on your fascinating career. So I appreciate you discussing that. I'd also love to hear if you're willing to share some comments on the major differences that you personally experienced between healthcare and research from your early career in Venezuela and then after you moved back to the United States.
Yes, and before we go into that, I think it's worth noticing that in human studies, the main powerhouse was actually the Ohio State University, where you are
Mm.
now based. And, Dr. Ronald Glaser back in 87, in the early 80s, and his wife, Dr. Tico Glaser, were like the fathers of this field in humans. They showed that NK activity was decreased because of stress in medical students. So medical students of Ohio State were actually, research subjects for many, many years. And they showed how vaccination was depressed, which is really relevant. Stress actually suppresses the immune response to vaccines, suppresses wound healing. Caregivers of Alzheimer patients had problems with influenza response. So this is just to kind of reiterate that psychoneuroimmunology has been a field that's been around for over 40 years, and still, like you say, is not well known. So I'm hoping that
Mm-hmm.
this sparks kind of the curiosity of the audience in terms of that. So going then backwards to Venezuela, I have to say that Venezuela is before and after 1999. I was very lucky to have the best medical training. My teachers had trained in Oxford, Cambridge, Stanford, Harvard. I mean, we had the influence of America and Europe, and I studied with books that you guys studied here, up to date, etc. After 1999, we have a horrible dictatorship that was extremely, it's been a terrible experience for Venezuela for 20 years. So in 93 I came with no gaps to Harvard from the EVIC, this research institute where I had trained, and then in a military hospital there I did my first clinical fellowship of allergy and immunology that I ended in 92. So in 93 I came straight to Harvard, and I was very blessed as well to be able to do research in asthma and immunology at the time, under the leadership of Dr. Jeffrey Drazen and Patricia Finn, who was my mentor at the time. So we had state of the art, and I think now there's a huge struggle. So
Mm.
there is a challenge for brilliant doctors. I call them heroes because they're still there. They're plowing away through all adversity. They have been able to maintain level, but it's suffered. I have to say that the quality of the training, etc., has suffered. So the main difference now is that here in the United States, we have this vast opportunity of access to knowledge, very easy, major academic centers. And I think what I love more about the United States is the possibility of doing clinical work and basic research work.
Hmm.
Being able to be a physician scientist is not easy to have it in Venezuela.
Mm. If you don't mind me asking, what's the one thing that you miss most from Venezuela?
Well, that's a very, very tough question because what I miss the most is freedom. And I have to
Hmm.
tell you, I mean, I'm actually in a political exile. We opposed the regime, and I had to flee Venezuela because of that. We had family very, suffered because of the regime. So I take this opportunity. I know I cannot speak a lot about politics here, but I can tell you that democracy is a treasure, and we don't have it in Venezuela now. And what I miss most is the freedom in Venezuela, and the beautiful. We have lovely people. Very, the Venezuelan are very caring. The physicians, we all, not for saying, are very caring doctors. And we learn in hospitals that were for poor, for underserved. So we learn to love the people that were underneath. So I've been working for a long time also with underserved communities here in the States, I have passion for caring for them as well. And they teach us, patients are our open books, right? I mean,
Hmm.
we learn because of them. And I of course mean we have beautiful beaches, mountains. Sometimes we feel that the mountains are touching the sky. And it's I have to say that I become a little bit emotional because I can't go back. So
Mm.
we're hoping that we can free Venezuela, and I'm sure we have the support from the United States, so we're very thankful for that as well.
Yeah, I had the pleasure. I had received a kind invitation to speak at the Venezuela Allergy Society meeting, but it was virtually. It was during the pandemic, so I have not had a chance to
Mhm.
visit and see the beautiful surroundings. But it sounds amazing. Well,
Yeah.
I appreciate you sharing some of your fascinating story to start, because I think that it does lend itself to why such a unique individual as yourself is here to talk about this topic. And before we really get into the topic of integrative medicine, can I just start by having you define what this term means? Because I think there's a lot of confusion surrounding that.
Yeah, that's extremely important. So, integrative medicine is kind of an evolution of what we used to call alternative and complementary medicine. Because, like around 15 years ago, 20 years ago, we realized that we want the best of both worlds, right? So, there are many things in standard care that are absolutely critical and needed. But at the same time, in the world of alternative and complementary medicine, there is a lot of things that can be offered to the patient. So, integrative medicine means that we actually approach the patient in a more holistic way, taking into account everything from the biological basis of the disease, but then again, looking at their emotional life, their nutrition, their wellness, the whole, a more kind of well rounded view. And in regards to that, I think that's kind of the future of medicine. In fact, it coincides with the development of personalized medicine in our field. The more we know about the immunology of our diseases, we understand that we have to be specific, even for asthma treatment that we'll speak a little bit
Hmm.
more later on about it. We need to know which type of asthma we're talking about so we can intervene better. So in a way, this personalized medicine with this integrative medicine approach, it just kind of takes into account other variables besides only the mere, just basic, let's say biological or bodily symptoms, but it takes more in account emotional and nutrition and wellness parameters as well.
Oh, it makes sense, and it's right there in the term, of course. I spend a lot of time online as part of my role with the academy as a social media editor and other things I do professionally, and I just see more and more healthcare professionals or quote unquote influencers applying terms such as holistic or integrative to their profiles or their titles that they have. So, how can we really tell the difference between somebody who's using these terms for marketing versus somebody who actually is trained or practicing integrative medicine?
Yeah, I think that's a very important point because I particularly think that it's very dangerous to be using these as buzzwords to promote
Hmm.
yourself. You know, I think that you have to look at the background, their training. This field needs training, right? I mean, it's not something that you can take in a weekend. Some physicians say, "Oh, I can take a weekend course and then name myself that I'm a holistic," right? So I would caution, right, that people that use it publicly to promote themselves. I mean, I in particular don't agree with that. For example, psychoneuroimmunology. Some people say I also don't use it, except on my academic profile because obviously it's there are fields of studies in one regard. In another ones, of course, is practicing. It does is a word that catches. I mean, I think there is a huge
Hmm.
interest, as you know, since the early 90s. Dr. David Eisenberg from Harvard, showed the huge interest and the huge amount of money people were putting in actually paying out of pocket for this type of care. So it's been a huge interest for the last 30, 40 years, and it continues. Many of the people we have in the committee that I asked them, why did you join us? And they said, well, because patients are asking me about this. So what I would say to people is, besides when they put it in their, in their announcement, just look at their background, look at their education. People have to train for that. Like I did a whole year of acupuncture, clinical acupuncture, for
Mm.
physicians in Venezuela. I'm a certified acupuncture in Venezuela, and I am planning to homologue that as well as I did my allergy and immunology. And as I also will, uh, talk a little bit about resources for physicians to train in this field if they want to.
Hmm. Oh, that's great advice, and I couldn't agree more. Of just, it behooves all of us to take the time and vet the person. Our credentials for any medical professional should be easily accessible online these days, and see what the actual training has been. And you had mentioned the increased interest among patients. Do we actually have data regarding patient preferences for this type of approach in their care?
Well, yes. I mean, it's out there. It's published. I mean, I don't have the numbers exact on me now,
Hmm.
but I know there is, you know, millions of dollars that people expend, out of pocket to pay for physicians or healthcare providers that have this expertise. So I understand that, something like 1 in 5 Americans are seeking this type of care. People like very much to be heard, because one of the characteristics of people that like me do this type of more holistic care is that we spend a lot of time with patients. So for me, it's impossible to see 20 patients in a day. It's not possible
Hmm.
because I have to
Hmm.
spend at least half an hour with each patient. First time, an hour. So, it takes a long time to really say, okay, what is the background? Okay, you have asthma, but what else is going on in your house? What is exacerbating? Why is this not getting healed, with the standard of care? And so we typically get more complex patients, more complicated patients that require that extra mile of investment. So, but I mean, it's easy, that the interest is increasing, and in fact, it is a sign of that is that the major universities in the United States of America have centers for integrative medicine, for
Hmm.
research, for providing health. For example, here in California, UC Irvine has one of the major and largest integrative medicine program, inclusive. I mean, they even have a pathway in the medical school as well. They received a very large donation, $200 million donation
Mm. Wow.
from a philanthropic Desamuelis, which were extremely generous. And then I know UCSF, UCLA, here in San Diego, UCSD also has a smaller integrative medicine center, and Scripps. I mean, there's a whole of interest, and New York, Boston, in DC area as well. So all over Chicago. I can't, Arizona. I mean, there is a lot of interest, and I think over the past 20 years they have really disseminated centers for, investigating and applying and providing healthcare through these integrative medicine modalities.
From my own interactions, this is purely anecdotal, but I'm sure you've had similar interactions with our colleagues. I know there's a lot of medical professionals and even lay people that sort of roll their eyes as soon as they hear the words integrative medicine, and often they equate this with voodoo or pseudoscience. So, is there actual evidence that supports this overall approach? And if so, what are some of the benefits? Just sort of speaking holistically.
Yes, and that's the huge challenge, and that's why I am very much into basic science, because I think once you start showing, you know, changes in the immune response, then we start talking in a different terms, right? It's not only, it's only not only the clinical response, but it's also showing mechanistics, evidence that things are working. So I think, we still have to go a long way. There is still a lot of prejudice.
Mm.
Um, so I want to introduce here the word paradigm. And I appreciate this question because I think this is a paradigm shift that has to happen in medicine. Paradigms is like the parameters that makes us say, okay, this is true, this is not true. It's many times it's unconscious. It's like we assume, paradigm is kind of the parameters that help us decide, oh yes, this is true, this is not true, or we can believe in this, we cannot believe in that, right? So I think a paradigm shift needs to happen in order to open our minds to this. And the more people that are very well, trained, that have a science based, are able to, disseminate their work, their findings, that's going to be opening that door to a paradigm shift in medicine, where we really understand that the emotional part is critical to understanding our patients, and that the nutrition is critical. Now the microbiome is getting, and
Mm.
over after 10 years finally gaining a lot of respect, that actually the microbiome plays a huge role. Then all about taking care, self-care, meditation, relaxation. So I think slowly but surely, we are, so there are, for example, there is literature. I mean, I can tell you, for example, in if you put in integrative medicine and asthma, for example, in 2010 there were very few, very few publications. Now in 2021 it came up to 128. Just the term integrative
Mm.
medicine and asthma, for example, and in 2022 now half a year we're up to 98. It's not a huge lot, not a lot,
Hmm.
but much more than it was, 10 or 20 years ago. And so there is much more interest, among this, and data, and double blind placebo controlled trials that are really making a huge mark in really preventing this rolling of eyes
Hmm.
of
Hmm.
our colleagues. Because listen, we are talking serious, and Ohio State has a wealth of data. I mean, I mean, they was not hocus pocus. Their NK cell activity was decreased by stress. Like, this is like hands down. You can reproduce it, and it's been reproduced in different centers, and so the response to vaccines. So now that we are in such a, with COVID, I did a whole presentation about the role of stress in COVID, and I think that stress is like the number one killer. So when
Mm.
you have a patient that has a bad challenge as an infection, as COVID, you need to keep that person up, and in upbeat, and not. And so we could spend hours talking about the immunopathology of stress. I mean, this is a whole area that would take us, and I'm actually going to write about this, hopefully, for the Quad AI,
Mm.
in as a review, a systematic review of all that literature.
Well, I want to I want to circle back to the stress component in a second, because I agree. I think that's very fascinating and extremely important for all of us to better understand. But you mentioned asthma, and maybe if we could have you walk through a couple of scenarios to help us all better understand. So let's say you have a patient in your practice who has persistent, poorly controlled asthma, whatever age you want. How would you implement integrative medicine into their care?
Okay, excellent question. Yes, so typically, besides doing the regular standard, PFTs and NO and all that assessment that we do, their allergies, assess their allergies, assess, everything. In addition to all that standard of care assessment, I add a whole time to understand what's going on in your family. Okay, what's going on in your life? How are your stress levels? Is there anything that happened recently? So I always go back. Okay, tell me, when did you get worse? What do you think what triggered? So the patient starts kind of looking back, and it's very fascinating that they typically can kind of identify something that triggered, right? And then of course, what I do in addition to the standard of care. For example, I have combined, some biologicals like Nucala, for example, in eosinophilic asthma, with integrative medicine. In what way? This is a patient that like nobody had stopped to really talk to her, Hispanic patient in particular,
Mm.
like in her 40s, and she kept going back into ER all the time, and tons of prednisone and some steroids, and so until I stopped her and say, listen, this can't be. You have to stick to the treatment, number one. And number two, so let's talk about what's going on. So just carrying her hand, and then I added some supplements, okay, that we know works, omega 3s that we know are very good, and there's literature about it. Increasing better her vitamin D levels, nutrition, probiotics that are critical. And in her case, that was what I did only. In other cases, when I had my private practice and in Venezuela, for 10 years, I had a concierge asthma and allergy practice. I would add acupuncture. And
Mm.
acupuncture has specific points in the chest and in the back and in the hands and in the legs that work on their respiratory system. And in fact, it's so fascinating that one of the points that are in the stomach meridian actually increases the levels of endogenous cortisol. So it has an
Hmm.
anti inflammatory effect. So there is actually a journal, it's called the American Journal of Acupuncture, and they have a very fascinating review that's just was out in 2021, and I can provide you with a reference where they actually are reviewing. The Chinese have done a major job in discovering kind of the basic science besides, behind acupuncture. Acupuncture, as you know, it's 5,000 years old. It's one of the
Hmm.
therapies that have resisted the test of time. And we know that it has several mechanisms of action. It uses the autonomic nervous system. It uses the somatic nervous system to, when you feel the prick of the needle, but it also uses the humoral. So it uses, neurotransmitter. It modulates cytokines. It's fascinating. In fact, if you denervate an animal, acupuncture doesn't work. If you remove the
Hmm.
sympathetic and the autonomic nervous system, acupuncture does not work. So you need an intact autonomic nervous system uh, in order for acupuncture to exert its effect, and also evokes potential. There is a way of measuring how you stimulate certain areas of the brain. And functional MRIs have also shown that certain points stimulate certain areas of the brain. So it is, acupuncture is not hocus pocus either. And the
Hmm.
French have done an amazing job in translating the complex Chinese medicine concept that is difficult for us Westerns to understand, to a more understandable way of looking at acupuncture. And that leads me to I train in medical acupuncture in Venezuela with a French school, and Helms Medical Institute here in California has a very similar training for physicians. So I can tell you more about it later if you want.
Yeah, so your patient with asthma, it sounds like it's medications, it's diagnosis, it's evaluation, and then really focusing on, as you mentioned, the stress in their lives, overall diet, other factors that really impact their underlying, geez, their pathophysiology and chemistry and biology. Well, what about one more example? How would you apply integrated medicine to somebody who has chronic spontaneous urticaria?
Right. Well, as we know, chronic spontaneous urticaria, we're only talking about that one, right? Once we have ruled out
Hmm.
all the causes, possible causes, etc., and we know it's really spontaneous chronic urticaria. In that case, well, I usually also use supplements. I make sure that the vitamin D is at a higher level. That really helps to keep their and once sometimes omega 3s also help a lot as an anti-inflammatory and probiotics. So I combine all those three things, and also helping them to understand, because stress has a huge role in this disease as well.
Hmm.
And sometimes awareness of, I have them make a diary, for example. Okay, try to make a diary and see, because some people think it's only random, and then they start understanding, hey, it's not that random. It's when I'm very stressed, then I have a breakout. So I think, of course, besides using high dosages of antihistamines that obviously work, um, it's very interesting to find that awareness. And for me, diaries are a huge help to kind of know when you're getting the symptoms and when you're not. And this brings me to the talking cure.
Mm,
Freud, at the beginning of the 20th century talked about the talking cure and how he actually, when the patient would talk about what was happening, he was able to make hysterical women walk again, that they were paralyzed,
mm,
right? I mean, he was famous in Europe because of that. And he talked about the talking cure. And I add to that concept, the talking cure is when we, as physicians, talk to the patient and talk in a kind way and reassure them that they have all their self-healing mechanisms inside of them. And I was very inspired by an American healer named Louise Hay. Years ago, I found her actually in the co-op in Harvard when I was looking to come to train here. And it was a little tiny blue book. And now then she wrote, multiple books, and now she passed away. But she left a huge and along with her many others, like the power of affirmation, right? The power of
mm,
belief. And so you don't, of course, only rely on that, but we know that somehow, we don't know the mechanisms why this is happening, but kind of returning the trust in them. And so then they're more compliant with the medicines, they're more compliant with their follow-ups. It's kind of a positive uh, kind of feedback mechanism that
mhm,
people really start behaving, and I think the awareness is key, right? And so then they start, and then sometimes I refer them to psychotherapy. So I have kind of my, as typical as a concierge practice, you have your network of specialists, right, that you refer
mm,
patients.
mhm,
Sometimes you can't do it all, but you can have good teams of people. And I think bottom line, integrative medicine is a multidisciplinary, let's say, make mode of working. Psychoneuroimmunology is by definition multidisciplinary. You need, basic immunologists, you need clinicians, you need endocrinologists, you need psychologists, the whole nine yards.
mhm,
So I think, the way I envision in the future, and this is like how to reimagine allergy and immunology, including integrative medicine. I know some colleagues may feel challenged, say, well, I don't have time to learn all this. Well, but you can connect with somebody that knows about this. You can maybe connect with an acupuncturist close to your office, and do a team work, right? Or maybe a younger or even older doctor can say, you know what, I'm going to invest 6 months in training as an acupuncturist, and I'll do it. It's not that complicated, really, for us as
mhm,
physicians. And it's fascinating. And we go that extra mile. Like, I've seen very severe asthmatics, and wean them off from steroid dependencies just by adding this strategy of stress management, doing the supplements, some of the supplements, and also acupuncture.
mm. Well, I think those are two great examples, and let's go back to the stress part of the equation because it's well established, as you know better than anybody, that many patients who suffer from chronic allergic conditions also have stress that impacts their symptoms or disease control. What do we know about this complex relationship? Are they stressed out because they don't feel well, or does their stress actually worsen their symptoms? So it's a chicken and egg sort of thing. And what do we do to address this? You sort of touched upon this already, but can you tell us a little bit more?
Yes, yes, that's definitely, there is a two parts to this equation, and I think it's kind of a vicious cycle, right? So at the beginning, stress may be a trigger, right? Maybe a trigger or an exacerbated. For example, there is data now that shows that even stress in the womb is a risk factor for developing asthma. So stress very early on in life of these children that then become adults is a risk factor to to have the disease. And in fact, very in like 20 years ago, a very important paper from came out from the University of Colorado showed how they chose the index case on the womb of the mom, and they followed them for 3 and 6 years, and they noticed that those kids that have all the genetics to become asthmatics, the ones that develop asthma were those in a higher proportion, of course, not all of them, but in a higher proportion, those that had family that were conflictive and that had a lot of stress, we're more susceptible to develop fully blown asthma. So
Mm.
this is just to say that it is a trigger. Then, of course, stressors in the environment, you know, also are a trigger. So I would say that stress has a role as a trigger, as an exacerbating factor, and then as a managing factor.
Mm.
So I think if you remove the stress of the disease and say, hey, we're going to manage it well, okay, you have one, two, three, four, five, you need to do all this to keep it under control. And then on the other side, then you say, okay, but let's now work with your environment. And that's when you want to reach out and have a social worker in your clinic if you can, or in the hospital. That's when you reach out to a psychologist or a family therapist and say, listen, I need help because this patient is not, we're doing it we're maxing out in all our biologicals, in our all our interventions, but yet we're having problems. Sometimes it's compliance, but sometimes it's just that it's so overwhelming what's happening that they need that this psychological help to cope with that. So I think
Mhm.
it's a double-edged sword, and we need to approach them two ways. So it is a stress in the environment, and it's a stress about the disease. So you, as a doctor, can remove the stress about the disease because you tried to manage it, right? But at the same time, you need that other professional, if you can't do it all, to help and aid. And that's why I'm a great believer on multidisciplinary
Mm.
approach. And I would be, I mean, I had it that way when I had my own clinic, where I had, a psychologist, a psychiatrist, where I would direct my patients, and I would guarantee that these patients were having that, and then a nutritionist, and then the role of the probiotics, and it's all these pieces that are working together to make things evolve well.
Mhm. No. Yeah, I always think about unintended consequences, and as you know, there's always a balance that we have to achieve no matter what we do. So I wonder if you could just offer some thoughts on potential downsides for those who favor or utilize an integrated medicine approach.
Yes, and I totally agree on that. First of all, and maybe this is not maybe not be very well welcomed by some. For example, I believe that some of these disciplines definitely have to be done by a doctor, right, an MD. You here in the States have very, very well trained licensed acupuncturists. These people train for 4 years after their bachelor, so they are really like doctors in many ways. So they're reliable. But for example, in Latin America, we don't have that. So
Mm.
in Latin America, if you want to do acupuncture, you have to be a physician, for example. Whereas here, no, here you have really well trained licensed acupuncturists. So what I would say is that you need to have well trained practitioners. Call it, chiropractic doctors, licensed acupuncturists, nutritionists. So you need a well trained provider um, for to do this. So downsides now is also that creating expectations to the patient that that you may not need standard of care, for example. So I think it's very important to tell the patient the limits and the possibilities of these interventions, right? And how to combine them with standard of care. Sometimes
Mm.
standard of care is not the ideal, right? You have to choose. For example, I think we have to limit a lot the use of steroids. Steroids, as we know, there's tons of literature. They're great anti-inflammatories, but they're also immunosuppressors. So it is a double-edged sword, right?
Mhm.
And so as with any therapy, you need to explain very well the pros and cons to the patients. You need to, so the downside I would say is if you come across a practitioner or a physician or that is not well versed. So that's why I insist, make sure that the training of the person is robust, the experience they have in this field. I always tell them venoms are natural because, oh, it's natural, doctor. Wait a minute, venoms are natural and they can kill you. So you can't just go out to CVS and just buy anything you want. You need to bring it to me. We need to check it out. We want to check out the dose. We have to check out who made them. The downside is that many of these supplements, are not standardized. So I
Hmm.
always say there are like three criteria to choose the right supplement if you want to choose a supplement. So you have, first of all, the manufacturer has to give you a guarantee that what they're putting in there is actually what it says, right? Number two, you have to choose a brand that has an external uh, verification agency or company or some sort of saying, okay, that this is true, what they say they're putting in there, and this is being done in FDA approved facilities, for example. And the third one is that they say, I offer you money back guarantee. I will
Mm.
give you refund, fully refund if this doesn't work on you. So you know that whoever is producing that supplement is invested in the quality of the product. And so what they're really saying about it, it's true. So I would always caution, right? The dosages is a big deal, and the you know the quality, and it's a huge challenge. And I think that's why I think we're working in that direction. Everybody that works in integrative medicine knows that we have to choose very well which are the supplements we recommend to the patients, the dose, the type, etc. Even within the probiotic field, there are tons of options. So you have to be very selective on that. So I would say
Hmm.
that you need to really be careful of that.
Thus far during our conversation, the theme is that it really requires a dedicated approach, proper training, and sort of the time to implement this into clinical practice. What are other barriers that exist towards implementing integrative medicine into clinical care?
Yes, well, you mentioned the challenge, the time you need with the patient, right? That many insurances don't want to pay that, so it may be very costly because many people have to pay out of pocket to obtain the kind of care they really
Mhm.
want. So I think that our battle, in my opinion, is to do more research saying, hey, we may be investing more time with the patient, but at the end of the day, it's going to be saving you money because this patient is not going to land in an ER, this patient is not going to land in a hospital. So if you convince the insurers that at the end of the day, it's better to pay more, invest 45 minutes with the patient, that is going to prevent you from getting complications. Whereas if you see them 15 minutes, you're not going to, it's impossible to
Hmm.
wrap the thing. So the barriers is, the time you invest with the patient and the cost of some of this. And then also the training. You also, I think we have to speak about the training. And as I said, many major universities even Ivy League universities have this type of approach. Um, but it's still resistance in medical school. There is still resistance.
Hmm.
And this is where the paradigms come. The paradigm shift has to come. Like, we really have to believe that besides teaching, what we call standard of care, my dream and my hope is that integrative medicine becomes standard of care, meaning it's a menu. Nothing is good for everybody. You know that. We know that as an allergist. We do immunotherapy that's tailor made for the patient. We don't do immunotherapy the same allergens for everybody. We have to find out what they're susceptible to. So I think our field is actually prone to this type of approach because we already, some people say, well, like our little magic tricks, right? When we're desensitizing patients and desensitizing, for to get a drug that we're allergic to, and we are able to give it to the patient because we do a desensitization protocol. So, we use already many things that are really alternative, that are non-conventional. So I think that the more we do individualized care, right, that we understand that not we don't have cookie cutters that we can fit everybody in the same package. We know that, we the more we understand the biology of asthma, right? For example, we know that anti-interleukin 5 does not fit everybody. There is a whole variety of biologicals because of that, because we need to individualize care. And so I think that's, in my view, probably the future, that we need to overcome that obstacle. And it requires this paradigm shift also, that, the caring of the patient goes a huge amount. When the patient really feels cared for, then they trust you more. Then they tell you more information. Then you can intervene better.
Hmm.
So, so I think,
Yeah. So
no,
no, it sounds like there's a lot that goes into this, and paradigm shifts take time. It takes time to learn more. And as of right now, for somebody listening, what advice would you have for the busy clinician who maybe completed their training years ago and they're interested, but they just don't have the time to dedicate to taking 6 months or a year or anything like that? Are there some good educational materials or other information that you can steer them towards if they want to learn more?
right. Well, so two things. I in one end, I would encourage people to team with other practitioners if they're interested in opening their scope, and then they say, either having in their own clinic or close to them, saying, I just did this kind of connection with this acupuncturist or with this chiropractor or with this nutritionist that I am referring my patients to. And then they will refer to you, in turn, their patients that need allergic assessment and they need. So it's kind of a win win situation for me working in team approaches. That's one route. The other route is that actually there is a lot of literature out there, in PubMed, and that is available. And also, us in Integrative Medicine Committee, we are actually we're going to start doing a journal club that it's internal to us, but
Mm.
we're going to have guests. So it's not broadcasted to the entire academy, but, we are going to be informing, and you know, people can come as guests. And I think, we're actually going to, um, be writing, actually, summaries, because we need update. The last time Jackie had it, publications in integrative medicine was like 10 years ago. So we're working on publishing reviews that can be helpful for our colleagues. And then also, I would say, looking forward to doing more podcasts about this specifically, more, because this was like an introductory podcast. I think we could, easily devote like one podcast to, let's see, okay, asthma options, or urticaria, or atopic dermatitis, which is a big one, or rhinitis, or, how do you approach that with you know, with a more integrative medicine approach. And in fact, we are going to be integrative medicine has, like, the emotional and the stress component. It has the nutritional part. It has the wellness part. It has, the acupuncture, which is a major intervention. And then it has the botanical intervention. And one of my dreams, if I may say here, is that one of my dreams is to create some sort of fellowship of integrative
Mm.
medicine for allergists and immunologists. That eventually I think would be so helpful, um, for all allergists and immunologists in different stages of their career. There's never too late to learn.
Well, I mean, you've accomplished so much in your career already, and you seem like a never-ending bundle of energy. So, if anybody's going to help with that, I have no doubt that you'll be heavily involved in something like that. Dr. Laura Marquez, this has been a great conversation. As you mentioned, this really is an introduction to these concepts of integrated medicine. I look forward to having either yourself or colleagues back on the show in the future to really take a deeper dive into these topics. But do you have any last words before we depart?
Well, I just want to thank you so much for having me, and for having Hemant Sharma, that I know will be coming hopefully behind me, doing his conversation about wellness. And I'm hoping that we can have other members. We have experts in the field in our committee that can, hopefully. I know you have a tough schedule, but that you may be able to add them to your menu of podcast. And I want to thank the Academy. I think the academy, for me, has been a place of personal growth and professional growth. and everybody I meet is best than the other. I mean, it's just a fascinating organization to belong to. So I feel very, very honored to be part of this organization and be able to be leading at this time the Integrative Medicine Committee. So
Well,
thank you.
thank you again. Oh, thank you. We hope you enjoyed listening to today's episode. Please visit www.aaai.org for show notes and any pertinent links from today's conversation. If you like the show, please take a moment to subscribe to our podcast through Apple Podcasts, Google Podcasts, or Spotify so you can receive new episodes in the future. Thank you again for listening.